people sitting in front of me. But sometimes during the course of your life, there's going to be something abnormal about you. It's just a normal process of aging and living, okay? And when that abnormality creates a healthcare issue or a problem or an illness or a disease or a sickness, your physician, whether it's a man or a woman, will try to help you determine what's wrong with you, okay? And in the course of trying to determine what that abnormality is, to define it so that they can correct it or improve it or change it or whatever, they've got to make a diagnosis. Diagnosis, okay? Is we have to define what the problem is, okay? You can't fix a problem correctly unless you define it correctly. The laboratory is a tool that physicians use to help them define the disease, okay? We need to be able to classify and categorize types of cancer because treatment of cancers are different, and depending on what kind of cancer it is, you will need to use a certain kind of treatment, okay? Because we don't treat all patients the same for their illness, okay? So that's because, and that's rooted in the pathogenesis or the mechanism of disease, because what we're doing is we're trying to study cancer, if you will, and understand how it works. And so if you understand how it works, then you can potentially interrupt its life cycle, if you will, and stop it from growing and kill it and cure the patient. So that's chest x-ray, and you remember the mass, okay? All right. So I'm going to show you a case, it's a real patient, that this person had a part of their lung taken out because there was a tumor in part of their lung, okay? Now,
Settle, please. Settle, please.
now, I don't have the three-dimensional image of the lung, but the lung looks somewhat like there are 5 lobes to the lung, okay? You've got 3 on the right and 2 on the left, okay? So they look a little bit like triangles, and they fit together in your chest, okay? And so when we get them, we inflate them with formalin, so we fix them, and then we cut them like a loaf of bread to look at the examiner. And so what these are is these are the slices
from the lung, okay?
Is that a whole lung?
No.
It's a part of it.
Hey.
So this is roughly what the specimen looks like. It's really bigger than this because there's some missing, but it has this tumor growing in it. Okay? So, what we do is we take a specimen like this. Now, ordinarily, this lung would be pink. Its color would be pink, but it has turned this dark kind of gray and brown color because we put it in formalin. That's the fixative chemical that we use that keeps this tissue preserved, okay, so that we can work with it.
So like the piece that you took out, is like that lung gonna grow back, or is just
No.
like, no, it's not going to?
Okay, so the lung has 5 lobes. This is the, I think this is the upper lobe of the right lung. So now this person, instead of having 3 on the right and 2 on the left, they have 2 on the right and 2 on the left. Okay?
Will they still be able to breathe normally?
Yes. That's a very good question. One of the things we do when we evaluate people that have problems, before they have surgery, we make sure they can tolerate the surgery, okay? Because we don't want to make them worse off with the surgery. You know, what good is it to do the surgery if they're going to be worse than when we fit? So that's how that works, all right?
How many lungs do you have?
It's alcohol, like grated alcohol, like, just like rubbing alcohol, 70% alcohol. And it goes like 70, 95, and then absolute, there's no water in that alcohol. And what we're trying to do is we're trying to get all of the water out of that tissue. So after we get all the water out, we infiltrate it with the hot wax. Just like, did anybody ever get like a pedicure or manicure, anything like that? Okay, so sometimes they get that hot wax bath, and that's basically what this is. And it's really hot. So you can see it's all, you guys can come close. So it's hot. We just start filling it up, so part of it's solidified. And what this does is it's going to go into that tissue. The tissue is placed in here. This is the reservoir. It's going to go into that tissue, and it's going to make it nice and hard. So, like, sponges. So, like, if you took a sponge, and you tried to cut it, it's going to collapse all the little holes. Right? If you took a sponge and you put wax in it, it makes it nice and hard, so when you cut it, it leaves everything open. So the holes for like the cells of the tissue, it's going to keep them nice and open, so our pathologists can look underneath the scope and see what's going on with that piece of tissue. So that's what we get. So you're like shaving it? I'm facing into it, it's called. I'm just making sure it's a flat surface. And then I'm pulling off that ribbon. And if you look at the side, it's really thin. It's very fragile. What I'm doing is I'm going to float it.
That is so cool.
In a nice warm water bath. And the water bath basically acts as a couple things. It takes and it stretches the paraffin, right, so you don't have any wrinkles, and it spreads it out. And it also softens that paraffin so that when we put a slide in here, it'll stick to the slide.
That's really cool.
So the other group was telling me that you guys look at slides. You look at slides?
Yes.
So somebody probably had to prepare all that. So this is what they did. tracing out here.
That in the lumen of the bowel, okay? All right, so they go in there with this, the scope I was telling you about. And it has a lens on it. And fiber optics, using fiber optic material, they can look, these scopes are like 4 to 6 feet long. So they look in one end, and the fiber optic image goes through the scope, and they can see out, and they can see this polyp, okay? And then the scope also has a channel in it that they put a wire through, and they put a wire through here, and they go and they put the wire around the base of the polyp, and they run an electric current through this wire, and it cuts the polyp off. So then you end up with that, okay? And then they retrieve it back out, they put it in a container, they send it to us, we process it in there, and we make slides out of it, okay? So what you're looking at is you're looking at the polyp. And the polyp is three-dimensional, okay? So it kind of looks like this. And then we take a knife and we cut it in half, into two halves, put it in the block and cut it. So that's why you see these two pieces on here. This is two halves of the polyp that's been cut like that, okay? So what you're going to be looking at is the polyp has a lining on top of it, like that. So this is the connective tissue where all the blood vessels are, because these polyp they have to live, so they get the nutrients and the blood supply and all through this middle part, and that's the light. See the light pink here? And then they have a covering on them. That's what's called the mucosa of the polyp. That's where all the action is. So when we talk about benign and premalignant and malignant polyps, the neoplasm, if you will, okay, this polyp grew in the bowel because it is a neoplasm. The cells on the mucosa are new growth cells. These are neoplastic cells. But my job is this polyp benign? Is it pre-malignant or is it malignant? Okay? So I can tell you just by looking at it that it's probably not malignant, okay? Because a polyp that's malignant, see this middle part in here, this nice light pink that has the blood vessels and everything? If it was a malignant polyp, these cells would have grown into this, and I would have ended up with this polyp that has this real dark appearance to it, where all these cells had grown, and we call this the head of the polyp, and they would have destroyed a lot of the top of the polyp, okay? All right? So